Starting treatment for multiple myeloma is a big step. And while you're focused on fighting the disease, there's something else you really need to keep on your radar: blood clots. Certain myeloma treatments can increase your risk of developing a clot. But here's the good news: with the right information and a proactive plan, blood clots are often preventable. In this HealthTree University lesson, we're breaking down what causes clotting risks in myeloma, the warning signs you should never ignore, and the simple steps you and your care team can take to stay ahead of it. Whether you're just starting treatment or supporting someone who is, this is essential information that empowers you to stay safe and stay strong. What should individuals who are starting myeloma treatment know about blood clots?
That's a very important topic actually, because myeloma, like any other cancer, leads to a prothrombotic state. In other words, by having a malignancy, we have a higher risk of developing a blood clot. So that's the first red flag that we should have in terms of blood clots for our patient population. But we have also therapies that can increase the risk of clotting, right? Such as IMiDs, both lenalidomide and pomalidomide can increase the blood of clotting, and it's very important to be proactive in some mitigation strategies with either a baby aspirin or a full dose aspirin, and even on occasions full dose anticoagulation, depending on what the clinical scenario is. Other proteasome inhibitors like carfilzomib can also increase the risk of clotting. So when we have a disease that can produce blood clots, but also we have treatments that have the potential of causing them, we have to be mindful, and that prophylaxis, it's extremely, extremely important. We should never forget about that at the time of treating myeloma, either in the newly diagnosed setting, the maintenance setting, or the relapse setting. As long as the patient is on an IMiD, such as pomalidomide and lenalidomide, or carfilzomib, they should be on some sort of DVT prophylaxis.
What are the signs of a blood clot?
Typically, the signs of a blood clot could be something as simple as leg swelling, right? An unilateral leg swelling, leg pain, redness of the leg. More severe cases that we could be suspecting a pulmonary embolism even could have a symptom of chest pain, shortness of breath, that is completely out of the ordinary for the patient. And when that happens, it's extremely important to seek immediate medical help, right? Because these events can be life-threatening if not addressed properly at the right time.
If you develop a blood clot, how is it treated?
If you develop a blood clot, either a DVT, a deep vein thrombosis, or a pulmonary embolism, then you have to be on full dose anticoagulation. The aspirin is no longer going to do the trick. When that happens, then that's typically a lifelong kind of event. We have to remain on that anticoagulation. Depending on the scenario, it can be interrupted at some point. But again, that's just case by case, and based on number one, how many blood clots has the patient had? Was it a precipitated event by something if the patient was traveling, etc. But typically, the patient will remain on anticoagulation, especially while they're on therapies. Okay, because that, once again, it can be led by the myeloma and the therapies that we provide to our patients. So anticoagulation is the answer.
What should patients know about the risk of blood clots when traveling?
Well, we have to remember that when you don't move too much, like for example, long plane rides, right? If you're going overseas to Europe, you might stay still in your chair for 8 to 10 hours. And that by itself can cause also a higher risk of clotting. So again, it's important to stay active even on the plane, just to walk around the aisle for a little bit, and to remain on your prophylaxis, either with a baby aspirin or your full dose anticoagulation, depending on what your scenario is.
Is there a role for compression socks?
I think the most important thing is just to stay active and make sure that you have your prophylaxis on you, right? I think it's the better way to produce it. But the compression stocking can also help. But the best way to have a compression is by moving your legs.
Thanks for watching. Starting treatment for multiple myeloma is a major step, and being aware of potential risks like blood clots is a powerful part of staying in control of your health. If you found this video helpful, give it a like, share it with someone who might need it, and subscribe for more guidance and support on navigating multiple myeloma. Stay informed, stay safe, and stay strong. We're here with you every step of the way.